Hi, welcome again to the section of cardiology. This is Dr. Jaitly. In this section, I'd like to discuss what is overweight and obesity and how do you define that. We all are very concerned and very aware these days of our weight, aren't we? So let's understand whether are we normal weight, are we overweight, or are we obese. So the National Body of Health the National Institute of Health within the United States has recommended to the rest of the world and to the World Health Organization that there is a body mass index chart that is a fair mechanism. It's a fair chart or fair measure to assess patients or people with normal weight versus overweight versus obesity. And they took only two variables into account. That is the height and the weight. So if the BMI, say on the chart, is up to 24, that's considered as normal BMI and the person is classified as carrying a normal weight. If the overweight is, if the patient belongs to the range between 25 to 29, then that is considered as overweight, and anything over 30 is obese, and anything over 35 is considered as grossly obese. Now, in other words, every kilogram of weight that's added is extra work for the heart. And in order for the heart to push blood through that extra mass, that's an extra amount of oxygen consumption and extra energy spent just to maintain that extra body weight, which is ultimately not required. So it's not good. I simply call it a kilogram. So every kilogram that you add in your body weight is called a kilogram. Now, what does the extra weight cause? Because ultimately we are concerned about the extra weight, but why worry about the extra weight? Well, as I said, it's a kilogram, so obviously it kills people. Obesity kills people, and the weight, affects the longevity of the individual is by causing heart conditions, high blood pressure, diabetes, and chronic fatigue. Invariably, a lot of people are short of breath. You'll see that they are not able to walk within room to room. Sometimes even getting out of bed and walking to the bathroom could be a problem. They tend to fall asleep in the chair while at work or while watching television, etc. during the day. At night, there will be tremendous snoring habits that one can come across. The spouses will constantly complain that he or she snores a lot. And that could be because of respiratory changes that develop during the time when person sleeps. Apnea, which is cessation of breathing for several seconds till he or she again starts breathing again. That can happen at night. A lot of the times the person is not able to fall asleep. It's called insomnia. And then many other things like constipation, because the GI disturbances will occur, and as a result, the person does not have a regular bowel habit preserved anymore. There might be stone formation within the gallbladder. Some arthritic changes or changes within the knees, within the hips, within your other joints will develop. Even some cancers have been reported, like the breast cancer and the colon cancer. And some thyroid abnormalities can also be found. So numerous multi-organ changes will develop as outlined here that will contribute to the morbidity, if you will, or the illness of the person, and obviously shortens the life as well, because all these conditions later on become life-threatening if they're not already to begin with. But over a period of time, as the patient continues to carry this extra weight for years and years, especially when you are carrying a BMI of over 30 for a long time, or over 35, that's gross obesity, these changes will develop, and then it's very, very hard for one to really get rid of that extra body weight, because the more you carry the weight, the lesser active you become, and therefore it's more difficult for one to lose weight. So it's a vicious cycle. So one really understands that overweight and obesity is the cause of multiple illnesses, multiple organ involvements, and therefore one really needs to stay active. We'll talk about how we spend calories and how we put in calories into our system, and how do you want to maintain its checks and balances in our subsequent presentations. Hope you found this part interesting, and let's stay tuned for more. Thank you for your attention.